আলাইকুম, আমার নাম মোহাম্মদ খায়রুল ইসলাম চৌধুরী। আমি একজন কম্পিউটার ইঞ্জিনিয়ার, অন্টারপ্রেনার এবং গবেষণা করি হেলথ, নিউট্রিশন, ওয়েলবিং এর উপর। কিছু ক্লিনিক্যাল স্টাডি ফলো করে একজন আমেরিকান ডক্টর হাইড্রোক্সিক্লোরোকুইন, জিঙ্ক এবং অ্যান্টিবায়োটিকের সমন্বয়ে কিভাবে ওনার পেশেন্টকে করোনা ভাইরাস থেকে রিকভারি করতেছে, এই নিয়ে আমি একটা ভিডিও আপলোড করতে যাচ্ছি। American president, Russian president and Ukrainian president, lots of other countries president already communicated with him. আমি আশা করি আমাদের বাংলাদেশের ডক্টররা এবং সায়েন্টিস্টরা এই নিউজটা পেয়ে গেছেন। যদি না পেয়ে থাকেন আপনারা প্লিজ ওয়াচ দিস ভিডিও and follow the clinical study. I'm also humbly requesting our respected Prime Minister, respected Health Minister and all the scientists and doctor, please watch this video and follow the clinical study. Inshallah, it will help. We can save our nation from this pandemic.
Real quick, we have a little bit of time left. I want to ask you about hydroxychloroquine. The president was pushing it pretty strong again yesterday. You said you have prescribed this. I want to talk to you about the effects you're seeing and what it might do for people who take it normally outside of coronavirus and a possible shortage of medicine for them.
Exactly. What we're finding clinically with our patients is that it really only works in conjunction with zinc. So the hydroxychloroquine opens the zinc channel, zinc goes into the cell, it then blocks the replication of the cellular machinery. So it has to be used in conjunction with zinc. We are seeing some clinical responses in that regard. There are people that take it regularly for other disease processes. We have to be cautious and mindful that we don't prescribe it for patients who have COVID that are well. It really should be reserved for people that are really sick in the hospital or at home very sick that need that medication. Otherwise, we're going to blow through our supply.
I started doing some research. I'm a primary care doctor for a small community of a square mile of 35,000 people that live within a square mile. The population density there is large. And I knew that when this infection hits, it's going to go everywhere at the same time. And I was concerned that I had nothing to help these people with. Up to this point, every single doctor on the planet will say to a patient who has this infection, go home, drink some fluids, take some Tylenol, and if you develop respiratory distress, go to the hospital. When they go to the hospital, they may end up intubated and develop acute respiratory distress syndrome. That's not very efficient in treating people, I would say. And especially we're running out of respirators. In the hospital, in the town where I am, our hospital is running out of respirators, and it's only going to get worse. So we really need a treatment option to intervene early to help these people. So what did I do? I started doing research. I looked into what the other countries were doing, and I looked into South Korea, and I found that they had treated their patients with hydroxychloroquine and zinc. I wasn't sure why, but that's what they were doing. And then there was a study that came out of France, Marseille, that they were using hydroxychloroquine and azithromycin, but that was done in vitro in the test tube, not in patients. So I wanted to understand how this virus works. And it's actually the same as all viruses. A virus cannot grow on its own. It needs to get inside a person's cell, and then it hijacks the cell's machinery to reproduce. It's a real parasite, and in doing so, it kills the cell. And can you hear me? I'm sorry.
Yes, you're absolutely fine. Coming through loud and clear.
And so I started realizing that zinc is a mineral that's well known to be used when people have colds, and there's a reason behind it. It turns out that zinc inhibits a certain enzyme called replicase. It doesn't matter the technical term. But that enzyme is within the cell involved in making copies of the genetic material of the virus. In other words, it helps the virus reproduce. It helps the virus grow in number. And zinc plugs that up. It throws a monkey wrench. It makes the virus not replicate as fast or stops it completely. But the problem with zinc, that it's a positively charged mineral and it does not cross into the through the cell membrane easily or at all. It's difficult for the zinc to get to the place where it needs to be able to fight the virus. So it turns out, what does hydroxychloroquine do? We're using this word a lot, but it's not magic. There is a theory behind it, a concept, which is very elegant and very beautiful. All hydroxychloroquine does is it opens a channel within the cell membrane and allows for zinc to go from outside the cell inside the cell. Once the zinc goes inside the cell, it begins to attack the virus by not allowing it to reproduce. So essentially what happens is the viral load of the patient goes down. And that's very important because in the majority of patients, the low-risk population, their immune systems are brisk enough that they could clear the virus before the virus hurts the lungs. Essentially, it's a race between the immune system and the virus's desire to destroy the lungs. Now, in people that are high risk, which I'll explain in a minute, their immune system is not fast enough in some cases to eliminate the virus. The virus takes hold and destroys the lungs. So whatever we can do to weaken the enemy, to weaken the virus, and give the person's immune system more time to overcome the virus, that is very beneficial to the patient. And the antibiotic that's also used is there as a guard. It protects against secondary bacterial infections. What happens frequently with viral infections, it damages the lungs, and that makes it more susceptible for secondary bacterial infections, which lead to pneumonias and those terrible complications. So that's the theory. That was the concept. So I decided to make a cocktail of taking the South Korean approach with the French approach, and I made a 3-drug regimen. I modified the doses to reflect less sick patients because I'm treating patients in the outpatient setting when they're not as severely ill. And I started to see patients and stratifying them into low risk or high risk. Now, let me define high risk. Anyone over the age of 60, anyone with chronic medical problems such as heart disease, diabetes, cancer, anyone with a compromised immune system. And I added one more criteria. Anyone that looked really bad in my office, that looked sick, that looked toxic, that had difficulty breathing. And those are the patients that I treated with the regimen. So let me give you the numbers so we can discuss the specifics. As of from March 15th till March 31st, I saw 911 patients that were diagnosed with this infection, with the COVID-19 infection. Diagnosis was initially made with testing. However, I ran out of tests. So I had to use clinical decision-making based on patient symptoms and history and exposure. And the fact that in my community, 75% of the tests were positive. So it was reasonable to assume if a person presents in a certain way that they have that infection. So I had 911 patients that were diagnosed. I treated with the regimen only 350 patients. The rest were low risk. They were sent home with supportive care, and they all got better. But the 350 patients, I intervened early, immediately in my office, giving this drug regimen to these patients. And let me share with you the outcomes as of today. I had 0 deaths. I had 3 patients admitted, intubated or on a respirator. Subsequently, 1 is off now, so only 2 are still on the respirator. And I had 6 patients admitted with bacterial pneumonia to receive IV antibiotics, and 2 of which already came home. Now, let's do some statistics. Depending on which country you look at, the mortality rate in the high-risk patients is between 5 and 10%. We're an advanced country, so let's take the lower number of 5%. So out of those 350 patients, we statistically should have seen 17 dead people and a multiple of that on respirators. What did I see? 0 dead people and only 3 people on the respirator. That was a significant discovery. And I'm not claiming to find a cure. I'd rather use an analogy. Imagine a frontline soldier happens to come across some very important intelligence. And this intelligence needs to be communicated to the top general because it's going to help win the war. And I saw the significance of what this meant. So I'm a simple country doctor. I don't have connections. So I made a YouTube video directly to the President of the United States. In Hebrew, they would say that's chutzpah. But I did. And the next day, Mr. Mark Meadows called me, the president's chief of staff. I was shocked. And he wanted to know what I was doing. I told him. He was very interested, and he told me to keep him updated. I had his email and cell number. And subsequently, the next day or two, I wrote up a protocol, and I spammed every single doctor I knew to see what they thought. And a day later, Sean Hannity calls me. And this is unbelievable. This is like surreal.
You're in a small town with you've got 35,000 people, and here one of the chief of staff for the president of the United States and Sean Hannity are calling you.
And
it must have been quite a video. It must have been quite a video.
He reads my protocol on air, talks to me a little bit, and then that was on the radio show. And later at night, he interviewed Vice President Pence, and he told the Vice President about my protocol. Fine. A few days later, I get a phone call from Rudy Giuliani, Mayor Giuliani, and he said he wants to do a podcast with me. So next day we did a podcast. I spoke for 40 minutes. And since then, things have gone global. I've been contacted by the governments of Ukraine, of Russia, of Israel. I'm dealing now with the Minister of Health of Israel, and they're already incorporating my protocols. This is very difficult to comprehend or to conceptualize for me, but how I ended up in the middle of this tsunami, this global war, this World War III, which we're really in. This is World War III. It's the virus versus humanity. And that's why I can't understand why we have academic researchers who, they still operate with a peacetime mentality. We should do a study, take 3-4 months, make sure that we are 100% sure that this is the right way to go. But the problem is we don't have time. I look at the statistics. Every hour, another 100 dead Americans. If we wait another 4 months, we're going to have 1 million dead people in this country. But this is not peacetime. This is wartime. And in war, we have to practice battlefield medicine. You know, where I am, there's no more labs, outpatient laboratories. They're all closed. There's no more radiology places. They're all closed. My office has quadrupled the number of patients that we were seeing. The hospitals are saturated. This is not normality. This is not normal. The world is no longer the same. So we need to adjust, and we have to be brave, and we have to take risk, because in war, you have to take risk, and it has to be calculated risk, and there has to be a risk versus benefit analysis. And that's what I did. That's why I wanted to initiate treatment with my patients. And by the way, these drugs are being used anyway in the ICU setting already in America. All I did was make a little modified cocktail and take it out of the ICU and put it into the primary care office.
I got very sick.
Amy Gamble went to Dr. Dmitry Yanez's clinic the day after she developed a cough, but she tested negative for COVID-19.
Even though my COVID test came back negative, they've been seeing some false negatives, and Dr. Yanez was convinced that I still had COVID-19, and my pneumonia was getting worse, and I literally couldn't breathe. I mean, I was probably a step away from going into the hospital.
Seeing a growing need, Dr. Yanez set up a COVID clinic in a tent outside his Bay St. Louis OBGYN office 4 weeks ago. There, he is evaluating, testing, and treating patients, including Gamble, with hydroxychloroquine in conjunction with the antibiotic Zithromax. He says the results have been spectacular.
I've